welcome. Thank you for joining us. This is the third webinar in the Gender Equity Unit's new series, Gender, Data, and Equity Expert Conversations. For those of you who are not aware, the Gender Equity Unit is part of the Data for Health initiative and is funded by Bloomberg Philanthropies. We are located in the Johns Hopkins Bloomberg School of Public Health, and our work aims to serve as a knowledge center and resource hub for all partners and countries in the Data for Health initiative and beyond to integrate gender equity into their work. We also provide capacity strengthening activities focused on gender equity for partner liaisons and key country players. And we conduct research studies to advance strategies for gender equity in global health through data systems. We're so honored to spend the next bit with our audience from around the world. We will have a question and answer session at the end of the webinar, so please feel free to write your questions in the chat throughout the conversation, and we will save them for the end. You're also welcome to raise your hand and come off mute during the Q&A section. We're also going to be sharing a brief survey in the chat. If you could just take a minute to fill it out, that helps us to understand where our audience is coming from. So today, I'm very pleased to be hosting a conversation with Dr. Shirin Heidari. Dr. Heidari is the founding president of GENDRO, which is a Geneva-based association with the mission to advance gender-sensitive research. She's also a senior researcher at the Gender Center, the Geneva Graduate Institute, where she's the principal investigator of a multi-country study on sexual and reproductive health and rights in forced displacement and humanitarian settings. In addition, Dr. Heidari serves as a senior technical consultant to the World Health Organization. She supports the Gender Equity and Human Rights team and the Immunization, Vaccines, and Biologicals Department. She received her doctorate in clinical virology and experimental oncology at the Karolinska Institute in 2001 and continued as a researcher there until moving to Geneva in 2007. During her professional career, Dr. Heidari has served as a board member of several organizations, including the European Association of Science Editors, where she founded and co-chaired the Gender Policy Committee and led the development of the widely cited Sex and Gender Equity in Research, or SAGER guidelines, which I do have a question about that when we get there. Most recently, she served as a commissioner to the Lancet Commission on Women, Power, and Cancer. So please join me in welcoming Shirin. So great to have you. Thank you.
Lovely to be here. Thank you so much, Michelle, for inviting me.
Yeah. So let me start with a general question. What brought you to work on gender equity? Why focus on this issue? What inspired you to do that?
That's a really great question. And it also helped me to kind of reflect back and see, where did I actually start? Mm-hmm. I do believe that already from a very young age, I did held very feminist values and principles. And I've been always very keen on social justice and very passionate about gender equality and women's rights, in particular, sexual and reproductive health. But I think in all of those passion led me at some point to engage a lot with human rights organizations when I was younger, but somehow I kept that separate from my biomedical research at the university. So it was kind of a later on, after my PhD, when I moved and transitioned into the field of HIV, which I really realized that how interconnected these issues are. And I realized that our health and well-being are really profoundly influenced by gender inequalities and societal inequities and the pervasive impact of patriarchal structures. So academic institutions obviously are no exceptions, and academic research and academia as such is also a result and an integral part of our patriarchal society. So it plays a very important role in terms of shaping and reflecting these inequalities in the research that is being conducted. So I think somehow along the way, I came to merge these issues together and kind of bring a gender and feminist lens to the work that I did professionally.
Yeah, thank you. And you've been doing this work for a long time. So during those many years, have you seen any shifts in a focus on gender equity or gender sensitive research and data? What have you observed throughout your career?
Yeah, I definitely believe that we have made tremendous progress over the last, 2, 3 decades. I've been engaged in this field, and now I realize how old I have become. um, there has been a lot of progress in terms of both recognition that sex and gender are important determinants of health and are important variables in research, which at the time when I started, there was a lot of both resistance and also lack of awareness around these issues. There are also more efforts going into that. So it's really great to see all these different initiatives by a number of different people, both in terms of addressing gender inequality in academic institution and in research institution, but also in terms of the content. And, again, I think there is more awareness around the gender data gap and the gender biases in research, in particular medical and health research. And I think all of these have led to both greater recognition, more work being done in this field, although I think still we have a lot of work to do.
Yeah, agreed. So as the founding president of GENDRO, you have a lot of this experience in advancing inclusive, nuanced gender data systems and research. So what would you say is what are the ideal elements of gender sensitive research, or what does a model data system look like to you?
It's really hard to say. There is no one size fits all approach when it comes to gender sensitive research and kind of data model systems. I think each study and analysis has its own unique aspects that requires really thinking around these issues more carefully. I always try to emphasize that the inclusion of sex and gender consideration really needs to be fit for purpose. It should be meaningful, and it should be tailored to the specific research question, to the specific context, to the specific analysis that one wants to do. So we don't advocate for gender sensitive research just for the sake of it. We just really firmly believe that there is a scientific rationale and a human rights imperative, obviously, as well. So we want really people to be mindful and ask questions when they design their research or when they're planning to collect data. Is biological sex relevant to the question that I'm trying to answer? Have previous studies kind of hinted at potential sex differences that merit further investigation? Most importantly, when there is research that's had an impact on humans, whether the humans are directly participating in the research or will benefit from the research findings, do we need to think about how does the gender consideration are important in these settings? How might gender impact the research in terms of needs, experiences, access, acceptance, preferences, user friendliness, and all of those things. So for me, a gender sensitive, or rather gender responsive or intentional research is one that really poses these questions at the very early stage and ensures that the researchers are also equipped, and the research kind of a process is well equipped to address these inquiries, and really building on kind of a previous evidence in that specific area, and also pave the way to kind of really advance our understanding of these issues.
Can you say a little more? So I heard you say gender sensitive, but rather gender responsive. I've also heard gender transformative. Can you say a little more about those nuances and why it's important?
Yes, and I think that could be kind of a long debate around what term is correct. And at the end of the day, I think terms are terms. I think when we talk about gender sensitive in the broader kind of gender kind of continuum that is being used mostly in development and even in the global health is, you are just mindful about that there are some potential sex or gender differences, and you're trying to design your research in order to be sensitive to those. When you talk about transformative approaches, is when you're trying to address the underlying causes of gender inequality, in particularly, or harmful gender norms that results in those observed gender disparities. So I think, and then in between, there's all kind of approaches. I kind of see gender responsive as a more of an umbrella term that allows people to respond to those nuances again, within their specific research, within their specific context, also knowing that there are a lot of political issues that shape to what extent people can address some of these issues in their specific area.
Yeah, thank you. Yeah. So why do you think a focus on gender in data is so important, particularly for health outcomes? So we hear about gender data in all sorts of realms, right? But a lot of the work that we do at the Gender Equity Unit, being in a school of public health, is focused on health outcomes. So from where you sit, why is gender data so important there?
I mean, data is really the backbone of evidence. And I think, that serves as a compass in how we navigate in our societies in terms of guiding us to make informed decisions toward equitable and just solution that can actually benefit everyone when we are dealing with the complex societal challenges of our time. So again, looking at sex and gender, and again, increasingly being aware of their intersection with additional dimensions such as age, race, ethnicity, socioeconomic status, and so on and so forth. We know that these play an important role in shaping how health issues, but also broader issues, are manifested and then addressed as well. So again, looking at data with that lens allows us to have a much more nuanced and better understanding and see how these challenges are affecting people differently, affecting different groups differently, and how. So again, without a data-driven, evidence-based approach, we will be stumbling in the dark, not knowing what works for whom, where, in which context. And again, a lot of those resources going into interventions that end up being not effective or not taken up would be a waste of our very limited resources, again, in the broader scheme of the world, when we see how we have huge inequalities and disparities.
Yeah, the allocation of resources is vital, right? And being able to have a clear picture of who's being affected by what can help with more strategic thinking and programming. So I've realized that you and I have only become in contact over the past year or so, but I realized in preparing for this webinar that I knew of your work from the HIV/AIDS world. So that's why you are so familiar to me. So you have this extensive career in sexual and reproductive health, HIV and AIDS. Have you seen any gaps in those fields in addressing and serving the full spectrum of gender diversity as it exists throughout the world? So what have you learned from that work?
Yes, no, I mean, obviously, these gaps exist everywhere, even in the sexual and reproductive field, even in the HIV field, there are these evidence gaps. But and specifically, if I start with the sexual and reproductive health, that's an area that has traditionally been focusing on particularly women's needs, but in a very narrow and not necessarily gender sensitive or feminist way. So I think that's why people also maybe conflate sometimes that, we do so much gender related work. We're focusing on maternal health, for instance, which is great, which is very well needed. But again, sexual and reproductive health is a spectrum of very different issues and are experienced very differently across this kind of a gender spectrum as well. So I think there are still remaining gaps in terms of really investigating the impact of gender equalities, gender inequalities, and again, harmful gender norms and roles and relations on the broader spectrum of women's sexual and reproductive health, as well as how they are kind of hampered in realizing their bodily autonomy. There's also a gap in terms of having a better understanding of the sexual and reproductive health of people of diverse sexual orientation and gender identities, and also examining men's sexual and reproductive health with a gender lens and with a feminist lens, perhaps. When it comes to the HIV field, again, I think HIV was one of those the HIV pandemic with all its kind of unfortunate impact that it had in our world also opened up and exposed a lot of issues with our societies in terms of inequities, inequalities. It really brought to light a lot of issues related to gender and sex, obviously, as well. And it really paved the way for us to rethink the broader global health I mean, again, thanks to really courageous efforts of, people living with HIV, patient advocates, researchers, clinicians, and so on and so forth, we made amazing progress and really shifted things when it comes to, again, inclusion of patients in clinical trials, access issues, intellectual properties, and so on and so forth. And again, a lot around understanding of the impact of, again, gender inequality, stigma and discrimination, inequities on the health and access to prevention, treatment, and so on and so forth. But despite those, there still remains, and again, I have been a little bit out of the HIV field for a while, but even then, that's how I actually got into this field, more or less, when I was the editor of the Journal of the International AIDS Society. And I noted like the majority of the papers that we were receiving really did not pay attention to sex and gender dimensions while we knew that these were important. So I think that planted the seed for the SAGER guidelines actually then.
Yeah. Yeah. So why don't we talk a little bit about that? So you led the development of the SAGER guidelines and educated me a bit on what that involves. Tell us a little bit about those guidelines.
So the SAGER guidelines, and I'd love to tell a quick story around how that was developed as well, but just to give our audience a little bit of a flavor of what those guidelines are. So SAGER guidelines are initially developed as a reporting guidelines and provides a comprehensive framework for ensuring inclusion of sex and gender dimensions in research and in particular in reporting. And again, while it was initially developed as the reporting guidelines, again, a lot of the questions, the checklists, and the tools provided are very valuable in also when researchers design the research project, but also can be used by research ethics committees and funding agencies when they evaluate proposals or research protocols as well. And, again, when I look back at the development of the SAGER guidelines, I always kind of look at it with pride. And I also see it as a story of really hope and transformation, because a very simple idea with no particular financial backing or anything have led to a valuable tool that has the potential to actually change the way that we are collecting and analyzing and reporting data. And that has been really great. So again, following when I noted that gap in the Journal of the International AIDS Society, and I realized as an editor, I actually can instigate some change. So I introduced a gender policy in our journal, and we were probably a pioneer in having such a policy in our journals. And after that, when I managed to convince a few of fellow editors that were editors of HIV journals, I kind of gained my courage. And when I was elected as the Council of the European Association of Science Editors, I decided that I would establish a gender policy committee, which I was really pleased to co-chair with Professor Tom Babor. And we worked with an amazing group of fantastic people who are very passionate and dedicated. And we developed the SAGER guidelines. And we carried out an international survey before we developed that, just to get a sense about how many journals do have such policies in place and what are the attitudes and opinions of similar policies. And of course, not unexpectedly, very few journals had such policy in place. But more disheartening was that a very large majority, and we kind of reached about 500 journals, almost 2/3 were either resistant of having such policies in place or thought it was not necessary or not needed. But despite that, I think we kind of went ahead and developed the SAGER guidelines, which were published in 2016. And I think, having witnessed that has been so widely adopted and more recently also adopted by the WHO is really rewarding, and just showing that, with some perseverance, you can actually change things at the end. A little bit of a patience needed.
Yeah, that's great. So it sounds like there were some journals, some key players who were a little resistant, seeing it was not needed. So how did you handle that? How did you make the case, or what other pushback did you receive?
I mean, at the time when we carried out the survey, we weren't necessarily kind of announcing that we were planning to develop a reporting guidelines. We were just really getting a sense of people's attitude. I mean, ultimately, when the guidelines were developed, and we did that through a very consultative and collaborative process, we really, again, all the members of the Gender Policy Committee, a number of other champions who were involved in that process. And again, we are talking about quite a large number of people who have been amazing champions of the SAGER guidelines, have tried to really push for these guidelines to be adopted through these their different capacities. And again, increasingly a number of journals who picked that up, individual journals, sometimes society journals, and then eventually the major publishers picked that up. So that has been really impactful because the major publishers usually hosting a huge number of academic journals, and when introducing that in their instructions to policies, that appears across all their journals. So that has been very impactful. But we also see increasingly organizations, research organizations, making a public adoption of the guidelines, endorsement of the guidelines, and also incorporating that in their either research policies or publication policies.
What about funding agencies, donors? Do you think we'll get to a point where they will require in, deliverables and reports that these guidelines are followed?
Oh, absolutely. I'm very hopeful about that. And I know that the NIH, obviously NIH Office of Women's Health Research, has done an amazing job, is really advocating and championing for similar policies in research funding kind of processes. The Canadian Institute of Health Research, the Gender and Health Institute, have already introduced such policies and also incorporated that in their application processes. So I think there are definitely great role models, and we have also been thinking about developing SAGER guidelines that are specifically tailored and customized for kind of application in research funding agencies as well as research ethics committees.
That's great. Excellent. All right. So over the past decade or so, there have been many threats to the continuation of work, particularly in the sexual and reproductive health research space globally. Many donors are facing political pressures, pulling back on their support. Has this political environment influenced your work and your approach to work, broadly speaking?
Well, we know that the political environment, undeniably influence anyone's working in sexual and reproductive health. It's difficult to imagine that it doesn't actually do that. And it's something that I've, of course, been very much aware of over the years, specifically working in the sector. I'm also very mindful of my privileged position, and again, very grateful for living in a country that gives me the freedom to carry out the work and doing the research that I do with integrity, which I know that is not the case everywhere in the world. Again, political influences very much also influence where research funding goes, who is allowed to do what kind of a research, and whether those research are allowed to be even published. So I'm extremely mindful about that. And I've been very fortunate to have received support from research funding agencies that understand the importance of research on sexual and reproductive health in these challenging areas. And again, that has allowed me to continue to work on that despite the fluctuating political environment. In terms of advancing sex and gender in research, that's a little bit of a different, while it's still interconnected with sexual and reproductive health issues. Again, sexual and reproductive health is also particularly political, as we have seen. But in terms of kind of a gender mainstreaming in research, we have seen really significant progress during the past 2 or 3 decades. And of course, it hasn't been without these challenges. We are seeing a different kind of resistance now. I think there is kind of emerging resistance toward gender responsiveness or gender kind of equality issues. And again, we have to wait and see how that evolves. But again, I'm optimistic by nature and an activist at heart. So kind of committed for us to continue working on this collectively and hoping that we will see some progress. But it's kind of a slippery slope, I have to say.
Yeah, yeah. Can you say more about the changes in the tension that you've seen throughout your career? Like how is it the reaction to gender, particularly sexual and reproductive health work, shifted?
I mean, that comes also with those kind of rise of populism and conservative political ideologies that comes to the surface, which are often quite, again, resistant to progressive kind of thinking or approaches to gender, in particular when it comes to recognition of diversity of sexual orientation and gender identities, which remains to be remains still a kind of a sensitive topic for a lot of conservative countries. And I think in that sense, they also kind of see any work around gender as implicitly including a work of advancing the rights of people of diverse sexual orientation and gender identities. But there is also a kind of a fear around the whole work around gender equality undermining those patriarchal and traditional norms. So I think there are kind of different angles to this whole tension that we see.
Yeah. And here in the US, we have a very heterogeneous population. And so we oftentimes we'll talk about intersectionality, right? And if you're looking at gender work, to look at it by other characteristics that might be adding to some of the health disparities, for instance, that we see. Have you seen in your circles, the work that you do, a resistance to this intersectional approach as well?
Yes, and again, it comes back to the whole issue of resistance to that broader understanding of inequalities and disparities. In Europe, we have also seen a political climate that is very tight on migration policies. And again, with that comes up the rise of xenophobia, for instance, among others. Again, a similar form of racism in the Europe as well. And again, I think in Europe as well, we also have very progressive forces. So they kind of play together. And again, it is...
Okay.
Europe is also very diverse in terms of its country, despite the European Union and the harmonization efforts. So yeah, we have also seen that. Not to the same extent to see kind of a really outright resistance to intersectionality. But again, we might also be working within circles that we're very kind of protected against some of those kind of opposing forces or opposing groups.
Yeah, yeah. Can you say a little more about your work as a technical consultant to WHO's gender equity work? So how are they thinking about data and gender?
Of course, I've been privileged to work closely with WHO since 2019 in my role as an external consultant. And here I just do need to make a disclaimer that today I'm participating in this webinar in my capacity from GENDRO, the association that I am founder of. So anything that I say, it's my own views and they're not reflective of any of the organization I'm affiliated with. So in my time with WHO, I've really had the pleasure to work closely with dedicated colleagues, both in the Department of Gender, Equity and Rights, as well as the Department of Immunization, Biologicals, and Vaccines and Biologicals. And with the latter one, with the immunization department, we have been really focusing on integrating sex and gender in the broader technical work, and do that with both departments. In the last couple of years with the immunization department, we focused a lot on really highlighting the important sex and gender issues in the development of the COVID-19 vaccines, both in terms of the research and development as well as delivery, and again, access and uptake. And we have issued, we have published it kind of a comprehensive guidance note, and we have done a systematic review to analyze the clinical trials of COVID-19 vaccines to highlight how these are, to some extent, not necessarily adequately examined. And with the Department of Gender Equity and Rights, I've again been supporting to integrate these dimensions in the broader technical work of WHO. And it's been really great to see that, again, thanks to the championing and the advocacy of colleagues internally, the WHO has now also recently adopted the SAGER guidelines. So there is definitely a momentum and a commitment to really advance integration of these dimensions and filling the evidence gap.
That's wonderful. Great. All right. I do want to invite our audience members to ask any questions they might have of you. You can put them in the chat, or you're welcome to raise your virtual hand or come off mute and ask. While we're waiting for questions, I did want to go back to something you said regarding the work on sexual and reproductive health and male involvement in that, men's sexual and reproductive health as well. I've noticed in our work that there, when we talk about gender data or sex and gender data, there is this assumption that it's maternal health, women's sexual and reproductive health, or sexual orientation and gender diverse individuals. What do you see as some of the gaps for male involvement and male data that might be useful to really address gender equity?
No, I really think we need to dismantle whole myth that gender equality obviously necessarily will have to benefit women because they have been historically disadvantaged, but it also benefits men and again, people across all the gender. And so does any efforts with regard to gender responsive research and data analysis, in particular in the health sector. Again, we might have we have created, I think, historically that the white male has been the norm. But having said that, there are also a wide range of men's health issues that needs to be kind of looked at from a gender equality perspective. We do know that certain areas, certain diseases are much more prevalent in men, some of them preventable. For example, we see that the higher mortality from suicide, for instance, mental health issues, road injuries, a lot of those have to do with, again, notions of masculinity that has a negative impact on men's health and well-being, and that with that comes also health-seeking behavior. So again, the issue of kind of creating a research ecosystems that takes these issues into account obviously will also benefit men. So I think, we really need to get away from that notion that any gender-related work is only focusing on advancing women's issues and women's health. Again, for that reason, we do have really good reasons to do that because historically women have been oppressed and, again, underrepresented. But having said that, that does not necessarily mean excluding the specific needs of men or men's specific health needs. And we have been collaborating very closely with other groups, the Global Action for Men's Health and Equimundos, which also work very much with feminist lens and feminist tools around men's health and men's engagement.
Yeah, that's great. And I was going to ask a follow-up question around the feminist perspective, because oftentimes there might be pushback from feminists that we need, because women and girls have been so disadvantaged for so long, we need to just focus on them, right? But you raised a lot of good examples of how some health issues are very specific to men and boys and involve masculinities. So how do you respond to that pushback from feminists or people who are advocating for the rights of girls and women?
I mean, I do definitely agree that because of that accumulated historical disadvantages that women have faced, there is obviously a need to put efforts and investment to really fill that gap and, create a leveling play field so that we can actually have sufficient evidence around these issues for women as have done in certain areas for men. But that does not necessarily exclude kind of addressing, because at the end of the day, men's health issues also becomes a burden for women. At the end of the day, we are working in a society when we're all kind of part of it and we are intertwined. So I personally have a much more holistic approach. And I think that, feminist values are valuable to me because they are advocating for fairness and justice and equality. And with that comes as well to address, overlooked areas when it comes to men's and, again, other people by diverse gender identities.
Absolutely. Yeah. Hi, I see you have your hand raised. You can come off mute.
Hi, everyone. Thank you so much for this amazing talk.
We're having trouble hearing you.
Oh, can you hear me now?
Yes, but maybe if you can speak a little bit louder.
Oh, okay, sure. So, thank you so much for the amazing talk. It was very insightful. I just have one question in regard to clinical trials and integrating women in it. So as far as I know, there has been no clinical trials with women integrated in it so far yet. Maybe you can correct that information if I'm mistaken. However, if that was correct and no women were part of any clinical trials, then how would we anticipate the effect on women's choice when it comes to bearing children? Because the main reason why women aren't integrated in clinical trials is because they are afraid of the circumstances that may lead to that woman bearing a child and then these medication affecting women in a bad way. So what are your viewpoints on that?
So it's not correct that women are not participating in clinical trials. Actually, women do participate in clinical trials. Most of the clinical trials I've seen, they include women. I think the problem is that women have often been underrepresented, usually that they have been participating at a lower rate in clinical trials, as well as the clinical trials have not necessarily been designed to really capture, sex or gender differences in the clinical trials in a way that could inform practice. The concern as well with women's participation in clinical trial historically has been that there has been, of course, a reluctance of enrolling women of childbearing age or childbearing potential in clinical trials with the assumption that if there are potential risks to the fetus, there is a protectionist view of that. But first of all, women have that right and the choice to make those informed decisions based on the risks or the evidence that is available. A lot of research can go into preclinical studies that can really examine how, for example, reproductive toxicity studies usually in animals provide very insightful information in regard to how, how dangerous or harmful can a drug or intervention be during pregnancy in terms of affecting the fetus. But it also kind of, for me, that there is this highly focus on protection of fetus is a little bit also unjust because women also get sick when they are pregnant. And, I have myself, for example, inflammatory chronic disease. And when I was pregnant, suddenly I realized I couldn't use the drug that I always use because of limited addition. But can have been really disruptive effect on women's health and well-being when they have only two choices. Either they use a drug or an intervention that is not tested during pregnancy, but they just take it because they have no other option, or they don't take it because there's not sufficient evidence and they might be suffering. And I think, looking at the broader scheme of things, then we must find ways that we can carry out clinical trials in pregnant and lactating women to be able to build up evidence around safety and efficacy and effectiveness of interventions for women during pregnancy as well. And there's a lot of efforts going on, including the PregLac, which is specifically looking at that, which is very important. And we have seen that in the COVID-19 vaccines as well, that, pregnant women, despite being at a greater risk, they were among the last group that actually had access because that data were not available to allow them to have an informed decision.
Yeah, can you say more about that? So from your view, how do we include more pregnant people in clinical trials? Is it a matter of, outreach, or is it incentives around it? Like what the safety that's or the lack of safety that's assumed, like how do we convince these underrepresented populations in clinical trials to be a part of them?
I think we have to ask the question differently, because the problem is not that people are refusing to participate in the clinical trials, and that's the same with women and other minorities. The problem is that the clinical trials are built in a patriarchal medical history, which do not favor the participation of these groups. So I think we need to rethink how we conduct clinical trials.
More
And I also,
kids.
excuse me. And I also believe that we also need to really invest in preclinical research and in developing different methodologies, different approaches that can ethically and safely engage pregnant women in clinical trials and make sure that we have generating the necessary evidence for that. So it is not that we just should include pregnant women in clinical trials and that's it. It is really much more thoughtful consideration. And with that, we do need to invest in that and prioritize this as a kind of urgent matter that needs to be resolved.
So reimagining what it means or how we structure those trials and the recruitment so that it is more inclusive of these other
Absolutely, absolutely. I mean, one of the things that I always mention is that when you report clinical trials and you see all the number of dropouts, none of them are disaggregated by sex. So you wouldn't see are women dropping out of clinical trials for gender-related reason, childcare responsibility, distance. So, or is it because they have, for example, sex-based differences in adverse event? So I think, it's really important for us to rethink the clinical trial and how we can facilitate participation, also with more participation.
Yeah, no, these are excellent points. I had one other question. So you talked a bit about how you are you've always been an activist, in addition to being a researcher and have this activist mindset. So where would you like to see work on gender and data go next? What's your hope for the future?
So as I mentioned, again, one exciting avenue that I'm kind of eager to advance is really the development of the SAGER guidelines tailored for research ethics committees, funding agencies, to really harmonize these efforts across the entire gatekeeping function in the research continuum and the research ecosystem. Again, there is a growing recognition of the SAGER guidelines also in the context of artificial intelligence, as we have seen how these huge biases in the data sets and algorithms can risk perpetuate the disparities and inequities that we see. So that's another area that we have slowly started to get into. There's also a greater need for a SAGER Plus, perhaps guidelines that look at the intersectionality and the intersecting factors together with sex and gender. And I think my vision for this work is to create a SAGER movement. We do encourage researchers and anyone to customize these guidelines to their specific areas, specific needs. For example, there is a group of experts that are now developing the SAGER guidelines specifically for outbreak analytics, which is amazing to see how it's got their own life. We have also seen different group of researchers just, again, very voluntarily approaching us and wanting to translate the SAGER guidelines in different languages to kind of facilitate uptake within their local research communities. So I see that, for us, all of us to come together and really pool our expertise and, activism in us to kind of create a research ecosystem that really champions inclusivity, equity, and equality, and kind of helps us at every stage of our research to really think about what we are doing is towards kind of realizing social justice.
Yeah, well, I speak for many of my colleagues to say that we're appreciative of the activist mindset on these things and really using data to advance a lot of these causes. One last question, because I know we have to let you go a few minutes before the top of the hour. So going back to your comment about AI, so I've been very interested in this and the gender bias that presumably underlies a lot of AI uses because of the bias in the data that it's built on. So My question to you is, given that is now, disrupting our lives, in a lot of positive ways, but, in very fundamentally, are you optimistic or pessimistic or sort of a combination of the two about where the future lies in gender and health data, especially as we incorporate these new technologies?
Oh, that's a very tricky question. Again, I am just optimist by heart. I just can't help it. I also think that these technologies, again, they are a product of humans. So we have the possibility to make sure that we use it for the best and the benefit of the humanity and everyone. And I think there are kind of a growing movements of really being mindful about the ethical concerns around the use of data, the biases in data, and all of those aspects. So I'm really hoping that our governments can keep up with the regulations, because a lot of those things also really need to be regulated in a way that can safeguard a number of these aspects. But I am hopeful in our collective effort. I always think that together, and there are so many groups working on these things, and we really need to also be mindful about that together we can put the sufficient pressure and raising the awareness needed to hope that the next generation of these models are better, fairer, and more just and more transparent and ethical.
Yeah. Well, I love the optimism, and we need that these days. We need that hopefulness. So thank you. Shirin, thank you very much for joining us today. Clearly, you have so much wisdom, and it's been my pleasure to have you be a part of this webinar series. For folks who've joined us, please sign up for our newsletter, follow us on social media to hear more about our upcoming webinars. Thank you all, and have a great day.
Thank you so much for having me, Michelle. It's been a pleasure speaking with you, and thanks for everyone else for participating. Have a good day, everyone.
Great to see you.